Despite a surge in COVID cases and hospitalizations, Missouri Governor Mike Parson says there is no longer a need for a state of emergency in the Show Me State. 5 on Your Side's Holden Kurwicki is digging deeper into how this decision will impact health care in our region.
It may be a new year, but BJC Healthcare Chief Clinical Officer Dr. Clay Dunagan says the pandemic is causing the same problems.
We're hitting case numbers that we've never seen before. And right now we're just about to surpass our peak in terms of the number of admissions and the number of people we have in hospital for COVID.
When Dr. Dunagan heard that Governor Mike Parson was allowing the COVID-19 emergency order to expire at the end of 2021, he almost couldn't believe it.
I don't know if the governor is looking at different data than we are, but it's hard to see that this public health crisis is resolved. And I know we're all anxious to get back to normal, but we're operating on anything but a normal footing inside the health system.
COVID-19 emergency orders allowed hospitals to bridge staffing gaps by shortening the onboarding time, turn hospital rooms into intensive care units, and expand capacity to operate with more beds than they're legally licensed.
I think our trajectory is one that's really going to put some stress on us to be able to take care of people.
Dr. Dunagan says
the staff inside of BJC will work to minimize any impacts inside the hospital. He says there will undoubtedly be a difference in more rural healthcare settings that depend on telehealth.
Patients are going to have a lot of trouble moving from one location to another. And having telehealth capacity lets us render care at a distance in a way that we really can't do normally. So the waivers were very important in helping accelerate that.
While the state is allowing healthcare systems to have some flexibility, Dr. Dunagan says it's time for legislators to step up and fill the gaps.
We want them to take a careful look at the things that the waivers enable us to do that have really been very beneficial for the healthcare system and take action on those things. I think most of them are not really that controversial. They really reflect the shift in the healthcare industry over time.
In St. Louis, Holden Kurwicki, 5 on Your Side.
20 states across the country still have emergency orders in place related to COVID-19, and that includes Illinois.